Good afternoon. Today I'll be talking about my chosen community engagement and my proposal to modify paramedic practice in relation to my chosen community group. It will include what the aim of the proposal is, a background on my chosen community group, an explanation on how I hope the proposal will work, potential impact of the proposal modification, and how I plan to implement the proposal into relevant paramedic practice. Throughout my 3 years, I spent at Australian Catholic University, or ACU for short. I have partaken in numerous placements that have been pertinent to my paramedicine degree. These placements have been completed through Queensland Ambulance Service, or QAS for short, and through ACU itself. All placements have had a substantial impact towards my degree, and the practical experience itself has been solely beneficial towards my future career as a paramedic. The most recent placement I've completed was with a program known as Achieving Results Through Indigenous Education, or ARDI for short, and has been solely related to my involvement with the Aboriginal and Torres Strait Islander community and learning about multiple aspects that contribute to their daily lives. I was primarily involved in working with students at a primary school located south of Brisbane, but will be discussing the modification for a proposal for the Aboriginal and Torres Strait Islander community as a whole. As paramedics, we are the first call for people in a vulnerable situation who require medical attention. We are likely to be the first face they see throughout their journey in the healthcare system, and the influence we have on each person can range from positive to negative and will have an impact on their journey throughout their medical care. The aim of this proposal is to modify the paramedic practice guidelines on the approach of the Aboriginal and Torres Strait Islander patient by creating and implementing a clinical practice guideline, CPG for short, that will further educate current paramedics in the workforce, as well as students at university studying to become a paramedic. The purpose for modifying and implementing this CPG is to allow paramedics to recognise, respect, and understand Aboriginal and Torres Strait Islander cultures and beliefs in order to pursue a more specific approach to the Indigenous patient. By using a person-centred approach will not only appropriately allow patients to be directly engaged and empowered in their care, but will take into account the patient's cultural and individual needs, their preferences, beliefs, values, as well as their comfort and surroundings. The intended proposal modification will not only be beneficial to the paramedic workforce, but the entirety of the Indigenous community within Australia. The planned learning objectives for the proposal guideline are to provide a general overview on how to approach the Aboriginal and Torres Strait Islander patient, to be equipped with awareness to build rapport and community partnerships to better the experiences for both paramedics and the Aboriginal and Torres Strait Islander population, to recognise and respect their culture, to understand the unique cultural and social influences, to be equipped with awareness of complex factors such as loss of traditional culture, fragmentation of kinship systems, discrimination, poverty, unemployment, homelessness, drug and alcohol misuse, and a decrease in traditional gender roles. It's also to understand why some cannot endure standard techniques of pre-hospital assessments and offer alternate methods of assessing patients, and using culturally appropriate, non-discriminatory, and accurate communication techniques. The learning objectives for the proposed CPG will not cover the entire complexity of the community, but provide a comprehensive overview with recognition to the Aboriginal and Torres Strait Islander community's needs and main points for care for both paramedics and students. For thousands of years, Aboriginal and Torres Strait Islander people have inhabited the traditional lands across Australia. They have lived in community and family groups and moved across the land following the seasonal changes. The concept of health and well-being in the Indigenous community is not just about the individual person, but a broad range view of the whole community that comprises of social, emotional, and cultural aspects. Lack of knowledge of the Aboriginal and Torres Strait Islander culture can often lead to cultural barriers and offensive misrepresentation of the community. These barriers are the main cause of unsatisfactory outcomes for an Aboriginal and Torres Strait Islander patient, as they are less willing to access the mainstream healthcare services that are available to them. Between 2005 to 2007 and 2010 to 2012, the life expectancy at birth improved from 67.1 years to 68.7 years for males, and from 72.7 years to 74.4 years for females for Indigenous Australians. Unfortunately, compared to non-Indigenous people, Aboriginal and Torres Strait Islander people still have a higher mortality and morbidity rates for major health conditions. They continue to be hospitalised at much higher rates for the majority of health conditions. They continue to have poorer outcomes of care, and they also have more restricted access to health interventions. An example of the most common call-out paramedics receive from Aboriginal and Torres Strait Islander communities is domestic and family violence. Due to social and cultural influences exclusive to the lives of Aboriginal and Torres Strait Islander people, such as gender-specific cultural roles and protocols, experiences of colonisation, dispossession, assimilation, racism, and the stolen generations, the wider understanding of domestic and family violence applied in other Australian contexts may not fully reflect the experience of Aboriginal and Torres Strait Islander people. It is often seen in this context that both men and women are both perpetrators and victims, engaging in aggressive behaviours of domestic and family violence. Often, the Aboriginal and Torres Strait Islander person prevents seeking help for domestic and family violence to avoid damaging consequences for themselves, their children, and other family members. As a result of these circumstances, Aboriginal and Torres Strait Islander people are hesitant to contact emergency services such as paramedics for the reason that they may fear vengeance from the offender or the offender's family, they may fear the Child Protection Agency will remove their children, they may doubt or fear the police, criminal justice system and mainstream services where they themselves have a record of violence or offending, they may fear the offender will be jailed or that they will die in custody, or they may fear gossiping and shaming by members of the local community. Indigenous Australians often experience poorer health than non-Indigenous Australians due to the lack of access to health services. This is a result from remoteness, affordability, lack of cultural safety, and the lack of knowledge and information about what services are available to them. The planned outline of the proposal for a CPG modification is to equip paramedics on road, as well as students studying to be a paramedic, to recognise and respect the cultural safety of the Aboriginal and Torres Strait Islander community, to be empathetic and understanding of at-home and personal situations, and provide information and services to the Aboriginal and Torres Strait Islander person to educate them on what is available should they need to access it. As mentioned, this proposal will not cover the entirety of the Indigenous population and what needs to be accomplished, but more so by providing a generalised approach using information and research gathered about Aboriginal and Torres Strait Islander patients. As paramedics, it is critical to assess the cultural safety when treating patients in the Aboriginal and Torres Strait Islander community. Such aspects include clear and respectful communication, respectful treatment, the inclusion of family members, and giving the patient the empowerment in decision making. By incorporating culture into a person-centered approach to an Aboriginal or Torres Strait Islander patient will allow them to be involved in their own healthcare plan and demonstrate that the paramedic responding is showing genuine interest and respect for the Indigenous patient. Cultural competency has been generally characterised as a set of harmonious values, principles, attitudes, and policies that enable people to work efficiently across cultures. Healthcare that is culturally and linguistically customised for Indigenous populations is highly recommended. Improving the cultural capability of paramedics and the healthcare system as a whole can be part of a successful resolution for diminishing racial or ethnic inequalities in healthcare. Paramedics who are educated with better cultural capabilities and knowledge can reduce these healthcare disparities. When a paramedic has been called to any patient, the first few minutes of the initial interaction is essential. Building a positive rapport with the patient and their family is important and is designed to assist with the overcoming of any fears or perceptions the patient or their family may have. Most of all, it will build the initial trust and respect from your patient to ensure a smooth and comfortable interaction from the start to the end of your time with them. Some examples of methods for gaining good rapport include greeting the patient in a warm and friendly manner, adopting welcoming and non-threatening body language and tone of voice, asking the patient where they come from, where they grew up, and ask about their family, introducing a relatable and common topic such as places you have visited in association with the Aboriginal and Torres Strait Islander community, telling the patient some things about yourself and your interests, explaining the processes of treatment such as procedures or skills that you may have to perform, asking the patient how they feel. Do they feel comfortable with certain procedures? And if not, offer alternative methods that may be suitable for them specifically. And lastly, offering clarity or any relevant information if they have any concerns. Being conscious of verbal and non-verbal communication is also essential when treating an Aboriginal and Torres Strait Islander patient, as it is common that standard Australian English may not be their first or primary language they use at home. Different tones, colloquialisms, and other elements may confuse meanings, and in the process, this may prevent paramedics from recognising essential cues to respond appropriately. Direct communication can sometimes be confronting for people, especially if they are in a vulnerable position of being unwell. In most Aboriginal and Torres Strait Islander cultures, it is often seen that they converse using stories, or they talk around the specific topic to explain the point, which can be how they need to describe how they're feeling. As a paramedic, it is important to engage with your patient's methods of communications, as it may be the only way the patient feels comfortable talking about what is going on with them physically, mentally, and emotionally. By interacting with methods of communication your patient is using will further build a positive rapport and increase your knowledge for the ongoing treatment of your patient. Some good methods of communication include allowing time to build a good rapport, being patient, listening, and allowing time for silence, implementing non-threatening body language, having a placid tone of voice and good eye contact, approaching the patient with a non-judgmental attitude, speaking in plain English, avoiding technical language and medical jargon, asking open-ended questions, simplifying information as much as required, always ensuring that the patients understand any information or explanations you are saying, using visual aids to assist with explanations, and reassuring the patient that confidentiality is implemented at the utmost level, but there can sometimes be limits of confidentiality if necessary. Ensuring access to primary healthcare for the Aboriginal and Torres Strait Islander population is broadly acknowledged as a key to improving health outcomes. As paramedics, we have a range of services outside our scope of practice that specialise in mental health, domestic and family violence, child support, and many more that we can educate the Indigenous community about. Not only should we be educating the Aboriginal and Torres Strait Islander community about these health services, but by having access to specific and relevant information will allow paramedics to be more comfortable in advertising what is available to the whole of the Indigenous community. By providing this information and explaining the purposes of these services will potentially improve the lives of those in the Aboriginal and Torres Strait Islander community. The purpose for the proposed modification for the CPG for the person-centred approach on the Aboriginal and Torres Strait Islander patient is to further educate current paramedics, others who are studying to become healthcare professionals, and essentially the community as a whole. As QAS allows the general public to access all CPGs, it will assist in keeping people informed on what is appropriate versus what is not appropriate, what is relevant and essential communication techniques, and the services and information that are available when medically treating the Indigenous patient. This CPG has not been suggested to single out the community as a minority, but more so to encourage paramedics and other Australians to educate themselves on the various cultures and populations that make up this beautiful country, and understanding the differences that each community has. A proposed method for implementing the practice modification is to design a CPG similar to the already published CPGs that are accessible through the QAS website. The design process of the CPG would include inviting members of the Aboriginal and Torres Strait Islander community and members of the ambulance service to have input into how the CPG would be expected to look, what information would need to be included, and how it would need to be presented. By including members from the Aboriginal and Torres Strait Islander community will ensure a more focused outlook onto the CPG itself and potentially have a greater impact on the community by knowing it's not just a generic document that has been created, but something that has had effort, knowledge, and care put into it. The Aboriginal and Torres Strait Islander population is still classified as a vulnerable population regardless of the efforts and achievements that have been involved in the evolution of the community over many years. As paramedics, it is our duty to be educated with the relevant and required knowledge to understand and appropriately treat members of the Aboriginal and Torres Strait Islander population. By introducing a clinical practice guideline within Queensland Ambulance Service will not only benefit current paramedics in the workforce, future paramedics, the Aboriginal and Torres Strait Islander patient and community, but the whole of the community as well. Thank you.